Hello everyone, welcome to sqadia.com, and now we will talk about section 4 of our lecture topic, menstrual cycle and hormonal disorder. In this section we will talk about the thyroid hormone disorder. Thyroid gland is very important gland that plays very important role in regulation of the menstrual cycle because it plays an important role in the ovulation. So that's why we picked this gland in this section because of the effect on the menstrual cycle and ovulation. So we will talk about the thyroid gland and then what are the effects of the low hormones produced by the thyroid gland and what are the effects of the high levels of the hormone produced by the thyroid gland. Thyroid gland is endocrine gland. It belongs to the endocrine system of the body. Endocrine glands are the glands which are the ductless glands, means they don't have any ducts. The hormones produced by the endocrine glands is directly released into the bloodstream because they don't have ducts to carry the hormones from the gland to the blood. So they are directly secreted into the blood. So that's the endocrine system. Thyroid gland belongs to the endocrine system. It's the largest gland in the neck. If you see the picture here, this is your thyroid gland. It's a big gland, butterfly shaped, has 2 lobes. So this is the thyroid gland in the neck. Thyroid gland produce 2 hormones. One is T3 and thyroxine or T4. T3 is triiodothyronine. T3, tri. Thyroid gland requires the iodine for the formation of its hormone thyroxine. So in this T3 you have 3 molecules of iodine combined to form triiodothyronine. And in thyroxine we have 4 molecules of the iodine, T4. Thyroid hormone production is regulated by TSH produced by the anterior pituitary gland. Thyroid stimulating hormone, TSH. TSH is produced by the pituitary gland. Here, if you see, TSH stands for thyroid stimulating hormone. It acts on the thyroid gland and it produces T3 and T4. TSH is very important for the diagnosis of any hypothyroidism and hyperthyroidism because in the blood then they find the level of TSH to find if the person is hypo or hyper. So thyroid gland, it belongs to the endocrine system. Endocrine system is the ductless system, no ducts. It's the largest gland in the neck. It has 2 lobes, butterfly shaped, and it produces 2 hormones, T3 and T4. T4 is known as thyroxine, and production of the thyroid hormone is regulated by TSH produced by the anterior pituitary lobe. Hypothyroidism. Hypothyroidism is the condition due to decreased thyroid hormone production. Thyroid hormone is very important for the metabolism. So metabolism is breaking down of the food products so we can get nutrition. So it affects the metabolism. Hypothyroid means underactive thyroid gland. Thyroid gland is not functioning very right and it doesn't produce the adequate amount of thyroxine hormone. Common causes of low thyroid levels or underactive thyroid gland are autoimmune diseases are very common. Auto means self-immune. In this autoimmune disorders, mainly you have antibodies produced against the tissues of your own body system. So, autoimmune disorders, surgical removal of the thyroid gland, low iodine levels, and it can be due to congenital disorders. Congenital hypothyroidism, if the baby is born with low thyroid level, it's really very bad, causes mental retardation if not early diagnosed and treated. So nowadays, mostly at the after the birth of the baby, one of the tests done is thyroid levels to detect hypothyroid level. Common symptoms or how the patient present with hypothyroidism is, since it's involved in metabolism, the patient feels very tired, weak, there is lot of weight gain, dryness of the skin, pulse is very pain, bradycardia is very common, and since it's related to menstrual cycle gets really very disturbed, infrequent menstruation. Sometimes after 40-45 days there is bleeding, and there is really heavy bleeding. Ovulation is affected. Infertility is very common in people with hypothyroidism because ovulation is not taking place at the right time. Cycles are not regular, and if cycles are not regular, then conception is very hard. Sometimes when females go for infertility treatment, the thyroid levels, when they are done, they have very low thyroid levels. And the good thing is, once the thyroid level, they start taking thyroxine, it's very quick recovery. Once the thyroid levels come back to normal, conception is really fast. So it's good, prognosis is good for low thyroid infertility cases. Then there is goiter also. Goiter, patients with hypothyroidism develop goiter. This is the goiter, enlarged thyroid gland, because the tissues try to overcome the low level. So in that case, the tissue grow and become enlarged. So this is the goiter, enlarged thyroid gland. Myxedema. Myxedema is very serious condition of hypothyroidism. This is the picture of the female with myxedema. Very pale, dry skin, puffiness on the face, like mental sluggishness is very common. They are very sleepy, and all these features occur. Weight gain, you can see this, all the puffiness. Treatment of hypothyroidism, as I mentioned, start on thyroxine tablets once a day, and once the thyroid hormone level comes to the normal, it's the maintenance dose. You have to take it for life, one tablet a day. So thyroxine, it's easily available and then you should do the blood test for thyroid levels every 6 months once it's adjusted. So hypothyroidism is low thyroid hormone levels, metabolism is affected, lot of weight gain, mental sluggishness, sleepiness, dizziness, tiredness, all these are very common. And then mostly due to autoimmune disorders and low iodine level. Goiter, enlarged thyroid gland due to the overactivity or overwork of the hormones, thyroid cells in the thyroid gland. Then myxedema is the common form of hypothyroidism. Next is the hyperthyroidism. If thyroid hormone is produced in increased level, then we have hyperthyroidism, overactive thyroid gland, increased level of T3 and T4, increased thyroxine. Again, symptoms are just opposite to hypothyroidism. And this patient is losing weight very rapidly, loss of weight, anxiety, sweatiness, tremors, bulging of the eyeballs. Here, if you see in this, bulging of the eyeballs is very common. Again, goiter. Due to increased level of thyroxine, we have goiters. So, and low level of TSH. TSH levels, once the T3 and T4 levels are increased, level of TSH is decreased. So increased level of thyroxine decreases TSH level, decreased level of thyroxine increased TSH level, and that's very diagnostic of hypo and hyperthyroidism. Causes are Graves' disease. Graves' disease is common type of hyperthyroidism. Patient is very anxious, sweaty, tachycardia, bulging of the eyeballs, all very common. There is increased level of iodine, and there is other example or other common cause of hyperthyroidism is thyroid tumors, also lead to hyperthyroidism. Treatment for hyperthyroidism is anti-thyroid drugs like methimazole. Methimazole is used to treat hyperthyroidism. So in this section, we talked about the thyroid hormone disorders which were produced by thyroid gland, and when we talked about two very common conditions of thyroid gland, one is hypothyroidism, one is hyperthyroidism, and what are their effects and signs and symptoms common in the patient. Thank you for watching sqadia.com.